The Food and Drug Administration warned on Monday that Johnson & Johnson's coronavirus vaccine can lead to an increased risk of a rare neurological condition known as Guillain-Barré syndrome, another setback for a vaccine that has largely been sidelined in the United States. Although regulators have found that the chances of developing the condition are low, they appear to be 3 to 5 times higher among recipients of the Johnson & Johnson vaccine than among the general population in the United States, according to people familiar with the decision. The warning was attached to fact sheets about the vaccine for providers and patients. Federal officials have identified 100 suspected cases of Guillain-Barré among recipients of Johnson & Johnson's one-dose shot through a federal monitoring system that relies on patients and healthcare providers to report adverse effects of vaccines. 95% of those cases were considered serious and required hospitalization, the Food and Drug Administration said. The reports are preliminary. In a statement, the agency said that while the available evidence suggests an association between the Johnson & Johnson vaccine and increased risk of Guillain-Barré syndrome, it is insufficient to establish a causal relationship. The agency added that it continues to find the known and potential benefits clearly outweigh the known and potential risks of the vaccine. About 12.8 million people, or about 8% of the fully vaccinated population in the United States, have received the Johnson & Johnson shot. By contrast, about 146 million have been fully vaccinated with Pfizer's or Moderna's vaccines, both of which require 2 doses. Guillain-Barré syndrome occurs when the immune system damages nerve cells, causing muscle weakness and occasional paralysis, according to the Food and Drug Administration. Several thousand people, about 10 out of every million, develop the condition every year in the United States. Most recover from even severe symptoms. The new safety concern comes at a precipitous moment in the nation's fight against COVID-19. The pace of vaccinations has slowed considerably as a new, more contagious variant called Delta is spreading quickly in under-vaccinated areas. Federal health officials worry that the news about another possible side effect from the Johnson & Johnson shot could make some people even more hesitant to accept not just that vaccine, but those developed by Pfizer-BioNTech or Moderna, even though no evidence of increased risk of Guillain-Barré syndrome has been identified with them. Those vaccines rely on a different technology. What worries me most is that it reinforces the lack of confidence that people had, said Dr. Stephen Black, an emeritus professor of pediatrics at Cincinnati Children's Hospital Medical Center and the co-director of the Global Vaccine Data Network, a consortium that researches the safety of vaccines. They'll say, "Aha, see, I was right.